Welcome back to another episode. This particular episode, we want to talk about one of our partners is going to give us some additional information. And Michael, why don't you introduce Jeff?
Yeah, so for those of you who have not met Jeff Segal, Jeff is a partner at ByrdAdatto. He's also the founder and CEO of Medical Justice and eMerit. Jeff is a MD-JD. He's a neurosurgeon and an attorney. And what Jeff has really built over the years is a lot of wisdom on the healthcare side as it relates to the patient and risk as it relates to the patient and just overall the patient relationship. So Jeff has had some, in light of COVID-19, some interesting conversations about waivers for those practices that are still treating patients and things that need to be considered for informed consent. So with that, here's Jeff.
Well, what a difference a week makes. We're in the middle of the COVID-19 crisis. I'm actually an optimist. I do think this will be over sooner rather than later. But we still got to get through, and how do we do it? I've talked to a number of different practices. Some have closed down entirely, with the doctors either staying at home or he's having his long-needed surgery. Others have taken a full steam ahead. We're still open for business. Nothing has changed. And then some have adopted a middle-of-the-road approach where they are doing virtual consults and trying to change the type of practice from a mostly surgical to a non-invasive. I can tell you, looking back at 2008, some of the practices that not only survived but thrived moved from operating room treatments to non-invasive. They were still doing a bit of everything, but they migrated the bulk of their activity to non-invasive treatments. They were fully positioned for the recovery, so keep that in mind. But in any event, I think the recovery will happen a lot more quickly in this environment. So one question is, how do you treat and manage patients who are having full operative procedures? Is anything different? And the answer is, in the background of a pandemic, maybe. I think the challenge is that anytime you have a surgical procedure, it's an insult to the body. You know that the stress response goes up, the immune system changes a bit. And I think patients should just be informed that if there is a pandemic in the background, they should know that there are modest changes that go along with surgery that could adjust their ability to tolerate getting the COVID-19 virus. So what would I do as it relates to informed consent? A little more than bring it up. I would state, and you can quote me on this, that surgery is a challenge to the body, causes increase in terms of stress, also changes the immune response. Most people will have no reaction to it, but it could potentially change a very mild COVID-19 infection, should you get it, into something that was a bit more severe. End of story. I think that's it. I think as long as you've had that conversation with a patient documented, I think you'll be reasonably safe. Now, of course, use good judgment. If hospital beds are filled up and there are people on gurneys out in the halls, it probably makes good sense to hold off on taxing the resources of the system. But by and large, if it's mostly business as usual, certainly in surgery centers, I would just have the conversation with the patient and document it. And that's all for now. Thanks.
And welcome back again. So thank you again for listening. Again, we will try throughout this week to have different times in which we'll share content with you and to making sure that you're thinking about these type of issues like Jeff has raised, something that a lot of people would not be thinking about because their day-to-day use of those consents is something they wouldn't have thought of how much things are changing with this new virus. And then more importantly, what are the other things you need to be considering? We'll be hitting you up throughout for our next episodes with the exact same things. Thank you so much.
Thank you.